Good morning, afternoon, or evening. My name is Jackie Gordon.
And my name is Ashley Clark.
And our topic of interest and what we will discuss today is role conflict between nursing practice and nursing research in the context of guiding ethical research principles. Today, we will describe the phenomenon of role conflict between nursing practice and nursing research. We will define the American Nurses Association Code of Ethics. They'll identify specific nurse researcher responsibilities in the context of research ethics that produce role conflict. The nurse researcher responsibilities and guiding ethical principles are respect for persons, beneficence, and justice. So, what does role conflict mean? Role conflict arises when a nurse is involved in research in some capacity and struggles between the demands of the clinician background and his or her research responsibilities. Tomlin, DeSalis, Torian, and Donovan define this conflict as reconciling the conflicting worlds of clinical practice and experimental science and the corresponding deontological and utilitarian ethics. Nurses who are also researchers must juggle different value systems. Society perceives that nurses value human rights and that nurses are trustworthy. Nursing, in and of itself, has its own code of ethics for nurses and focuses on the priority of caring for the patient. Finally, nurses as researchers have responsibilities related to discovery and scientific inquiry. The nurse, as the researcher, must balance all three value systems while attempting to conduct ethical research.
I would like to begin my part of the presentation by briefly talking about the history of the American Nurses Association, which you know is also referred to as the ANA. The American Nurses Association has actually been in existence dating back to 1896, when fewer than 20 nurses attended the first convention. The American Nurses Association was formally founded in 1911. Since 1911, the ANA has expanded in many ways. According to the ANA, over 100 years later, the American Nurses Association has grown in membership, expanded its services, published a vast collection of material on nursing practice and the profession, established a code of professional nursing, which I will expand upon shortly, developed and instituted the means for registered nurses to be credentialed in areas of specialization, but most of all, became legislatively involved to advance the nursing profession so that the roles, duties, and practice areas of nursing are respected in the world today. So as you can see, advocacy for the profession is also a very important part of this association. Also, according to the ANA, the Code of Ethics for Nurses was developed as a guide for carrying out nursing responsibilities in a manner consistent with quality in nursing care and the ethical obligations of the profession. The first formally adopted nursing code of ethics was in 1950. Did you know that 2015 is actually named the Year of Ethics? This is due to a revised release of the Code of Ethics since 2001. I have provided the link for the revised Code of Ethics at the bottom of the slide for your review. The ANA defines the Nursing Code of Ethics of having three main purposes, which include: first, it is a succinct statement of the ethical values, obligations, duties, and professional ideals of nurses individually and collectively. Second, it is the profession's non-negotiable ethical standards. And three, it is an expression of nursing's own understanding of its commitment to society. A December Gallup survey actually ranked nurses as the top profession for honesty and ethical standards for the 13th consecutive year. I'm going to play a video in regards to them talking about nurses being ranked as the top profession for honesty.
that time of year when we update Americans' ratings of the honesty and ethics of selected professions, something we've been doing on an annual basis for many years now. Let's look at the numbers here and see what we find. First thing I would highlight for you, medical profession does very well. The top 3 professions that we tested this year in terms of their perceived honesty and ethics, this is the public making these perceptions, are in the medical profession. Nurses, congratulations, once again, top of the list. 80% of Americans rate the honesty and ethics of nurses as very high or high. I should point out 15 points higher than medical doctors, and pharmacists also at 65% tied with medical doctors. So nurses at the top of the list, then medical doctors and pharmacists. What's at the bottom of the list?
So we know that making decisions based on a sound foundation of ethics is an essential part of nursing practice in all specialties and settings. And since the nurse's traditional beginnings, many different roles of the profession have expanded. One important role that helps to develop and advance the profession's body of knowledge and provide a scientific base for clinical nursing practice, as we previously mentioned, is the role of the nurse researcher. As previously stated, role conflict arises when a nurse is involved in research and struggles between the demands of the clinician background and the research responsibilities. There are actually 9 provisions within the revised 2015 Nursing Code of Ethics. Within these provisions are subcategories. Due to the ethical obligations of the Nursing Code of Ethics, it can be apparent why role conflict can arise when a nurse is involved with research. As I proceed through the presentation, I'm going to talk about the 9 provisions included within the 2015 Nursing Code of Ethics. I will provide some examples of how role conflict can arise when following our non-negotiable ethical standards. While I explore these areas and talk about role conflict, I would like all of you to reflect upon role conflict within these areas as well. Provision 1. The nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. Encompassed within the first provision is a subcategory of relationships with patients. As nurses, it is important that we establish a relationship of trust, setting aside our bias. Role conflict can arise from quantitative and qualitative research projects. However, for my part of this presentation, I will be primarily discussing qualitative aspects. Later in the presentation, qualitative case studies will be presented. Strong interviewing skills are needed for effective qualitative interviews. Since nurses learn that building a rapport and establishing trust is a necessity for positive outcomes, one may think that this would help with obtaining an effective qualitative interview. However, according to the article by Susan Jack in 2008, it is important to be mindful that there must be balance so that bias is not introduced. Also included within this provision is a subcategory of nature of health, which is the appropriate use of interventions to optimize health and well-being. It's also important to take note the goal of our research project. Will providing or recommending an intervention threaten the validity or objectivity of the data? Provision 2. The nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. Primacy of the patient's interest, which is also a subcategory within this provision, states that honest discussion about available resources, treatment options, and capacity for self-care are essential. Nurses in all roles must identify and, whenever possible, avoid conflicts of interest, which is also a subcategory. Examining and predicting what conflict can arise during the role of the nurse researcher may help to alleviate future circumstances. Examining and recognizing one's own personal prejudices and biases is an important consideration. Professional boundaries, yet another subcategory, patient confusion of the role of the nurse researcher, which will be discussed during the presentation, respect for persons' informed consent. Provision 3, the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. One of the 6 subcategories encompassed within this provision includes protection of human participants in research, which will also be discussed during respect for persons, the informed consent. Provision 4, the nurse has the authority, accountability, and responsibility for nursing practice, makes decisions, and takes action consistent with the obligation to promote health and to provide optimal care. Provision 5, the nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. Provision 6. The nurse, through individual and collective effort, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality health care. Provision 7. The nurse, in all roles and settings, advances the profession through research and scholarly inquiry, professional standards development, and the generation of both nursing and health policy. Contributions through research and scholarly inquiry, which is encompassed within this provision, states that nurses remain committed to patients and participants throughout the continuum of care and during their participation in research. Provision 8. The nurse collaborates with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. And Provision 9. The profession of nursing, collectively through its professional organizations, must articulate nursing values, maintain the integrity of the profession, and integrate principles of social justice into nursing and health policy. So to summarize, our profession holds high ethical standards. To maintain our high ethical obligations, one can reflect how conflict can arise within these provisions in subcategories.
In 1979, the Belmont Report was issued, and from that research, ethics principle of informed consent was born. Informed consent provides participants with sufficiently detailed information regarding the study so that they can make informed, voluntary, and rational decisions to participate in the research study. The nurse researcher can experience role conflict during the informed consent process. In a recent study, Tomlin, DeSalis, Torian, and Donovan examined nurses who were recruiting for randomized controlled trials. The nurses were provided digital recorders and audio-recorded recruitment interactions that they considered suitable, with the patient's consent, of course. After the recruitment session with the nurse researcher and patient was recorded, the nurses were then individually recorded during in-depth interviews using a semi-structured interview by the researchers, looking into how nurses have role conflict during the informed consent process. The nurses in this study affirmed and emphasized their identity as clinicians, quote, first and foremost, quote, and as patient advocates versus researchers during informed consent. An excerpt from one of the interviews states, quote, I think what you've got to remember is we're nurses first and foremost, and that's a huge difference between being a researcher and a nurse. As nurses, we care, end quote. The nurses in this study told potential subjects during the informed consent process that they were nurses. However, they were in the recruiter role. The researchers picked up on this and asked the nurses during the semi-structured interview to comment on this. So you all have got the nursing background and you decided to share that with the participants, stated the researchers. The nurse answered, quote, we do, yeah, and I do use it, my nursing background that is, because it's helpful initially during the informed consent, because the parents know that I do have a clinical responsibility to do my best for them in this role. It is a very different way to work, you know, to what I'm used to in the wards. As a nurse in your uniform, you know, you've got a certain role and it's clear, respectful, and that's a lot of power with that as well. And then to actually have that taken away from you. So the nurses felt that their role as a nurse was more important than being a recruiter for a trial and wanted participants they were consenting to know that they were in fact nurses. Finally, during the informed consent process, the nurses stepped out of the recruiter role and met potential subjects' clinical needs. An excerpt from one of the semi-structured interviews states, Quote, I'm seeing them when they're feeling absolutely rotten, and I'm holding the vomit bowl, you know, and caring for their immediate needs. You don't just switch that off and get someone else to do that. The nurses clearly exhibited role conflict during the informed consent process. In addition to the ethical principle of respect for persons, the guiding principle of beneficence is also outlined in the Belmont Report. Researchers have an ethical obligation to act for the benefit of the individual and protect human subjects from harm. The research must be sound and not unnecessarily expose subjects to risk. Risk must be balanced and minimized. Safety provisions and monitoring must be adequate for participants in the trials. I will outline how this presented role conflict when nurses were recruiting for randomized controlled trials in the Tomlin study. Ashley will outline how the ethical principle of beneficence presents a conflict for the nurse during qualitative interviewing. In the Tomlin study, nurses in the researcher role in one of the groups they examined did not believe that the researcher was sound. A nurse can only ethically offer randomization when he or she believes there is equipoise. One of the group of nurses did not believe in the trial rationale, and they did not expect useful clinical knowledge from it, so they lacked personal equipoise. This led them to act toward a clinician role versus a researcher role, hindering recruitment for the trial due to the fact that they believed the trial provided no benefit and only provided risk. Nurses also believed that for particular patients, less intervention was associated with worse outcomes, and more intervention was associated with unacceptably burdensome processes. One nurse watched patients who were on the monitoring arm of the trial like a hawk to detect deterioration. So the nurses in this study really did believe that the risks were sometimes greater than the benefits, and they also did not believe that one of the studies had equipoise. Being a nurse and a researcher at the same time presents a unique perspective when examining risks and benefits.
As many different circumstances can arise involving role conflict between the nurse and the nurse researcher, I would like to provide you with a few case study examples and have you reflect upon what your own actions would involve if you were the nurse in these case studies, and what examples of conflict do you see arising in these examples? One must constantly reflect upon what is the risk-benefit if I intervene and how I intervene during a qualitative research project. The first case study is presented in the article by Wilkes and Beal in 2005. Quote, an informant who was collecting data in a neonatal intensive care unit where she had previously been the nurse educator related the following. I was left alone in a room with 6 ventilated neonates. One of the neonates was very unstable, and I was forced into the nurse's role. I was ethically obligated to act when a neonate dramatically desaturated, a life-threatening situation. When the nurses returned to the room, they were quite happy with the fact that I had to intervene. However, since then, I make it quite clear that I am not legally covered to take on the nurse's role, and therefore unable to answer phones or turn off alarms, etc. Quote. So could any of you relate this example to your own area of research? Commentary and judgment from 12 experienced nurse researchers on the appropriate action of the nurse researcher in this case sample included. Quote, all of the nurse researchers felt that the nurse researcher in the case acted appropriately in the lieu of the life-threatening nature. Ethical framework of beneficence and accountability for nursing action. However, some participants felt that she should have summoned for help, that the role boundary was not clear to the staff, and the researcher should have made it clear to the staff beforehand what should be done if a circumstance like this were to occur. In addition to the previous case study, some additional qualitative scenarios to reflect upon from the article by Jack in 2008 include: a nurse observes a mother struggling to latch her newborn to the breast, or a nurse observes an elderly patient having difficulty getting out of bed, or a nurse hears an adolescent express thoughts of suicide. Some areas to consider would be: what are the roles and responsibilities of the nurse researcher? And would intervening affect data collection and or analysis? And does the code of the Nursing Code of Ethics impact these scenarios?
Justice is the final guiding ethical principle that states that there must be rationale for inclusion and exclusion criteria and treatment allocation. Justice also ensures that there is equal distribution of risk and benefit. Referring back to the Tomlin, DeSalis, Torian, and Donovan study, the nurses displayed empathetic preferences during recruitment that altered the inclusion and exclusion criteria. They felt they could encompass the entire patient assessment to determine inclusion-exclusion criteria above and beyond the study protocol. Nurses views arms as less desirable for certain patients due to nurses interjecting their own patient suitability criteria for trial participation outside of the protocol. Nurses encompass patients' life world or beliefs, current circumstances, current relationships, their life plans, hopes, fears, expectations, psychological features, and values, all in addition to the protocol assessment inclusion criteria. The nurse's intimate knowledge derived from patient appearance, clinical notes, and their interactions with the subjects also influence patient allocation to either treatment or control group. The nurses believed that less intervention could lead to undetected deterioration of the condition. The protocol said that he was suitable for randomization to the monitor group. He was in his 50s, and I didn't. It didn't sit comfortably with me at all. So, first and foremost, you're a nurse, and I actually talked to a consultant about it first. End quote. So the nurses did struggle with their role as a nurse versus a researcher when allocating patients because they believed that there was increased risk and it was not equal and there was not justice. The nurses experienced role conflict when determining rationale for inclusion and exclusion criteria for patient allocation to treatment and control groups. We have outlined how the nurse researcher must balance the demands of society, the profession of nursing, and research. Role conflict can occur when the nurse attempts to adhere to the guiding principles of research ethics, including respect for persons, beneficence, and justice. Thank you for listening to our presentation today. Please see our additional readings and discussion questions, and we look forward to your insights.
Thank you.